Hello, this is Dr. Scott Warner. I'm the Municipal Health Officer for the City of Cullman, and I'd like to briefly update you on the status of COVID in the City of Cullman, the county, and the state of Alabama, as well as the nation. I'm bringing you this on behalf of the City of Cullman, and it's not necessarily representative of the hospital administration's point of view. The current status of COVID, as you know from your neighbors and from the media, is currently increasing across the globe, nationally, and of course here in Cullman. Even within the last 7 days, we've had nearly 100 people test positive for COVID in Cullman. That brings the total number of positive cases in Cullman to over 200 in the last 2 weeks. We've had a total of 205 of our Cullman neighbors die of COVID since the pandemic began. That is extremely unfortunate, of course, and the state of Alabama today will reach a new milestone with 600,000 positive cases of COVID since the pandemic began. The average age of people in the hospital is now 54, and that is a significant decrease. In the first wave of COVID, the patients who were hospitalized tended to be older, near 70. Now that number has decreased down to the low 50s, which is representative of the fact that majority of the people who are vaccinated are in fact older, and so the disease is now predominantly attacking those in the younger age groups who may or may not be vaccinated. The percentage of those 35 and younger with COVID is now 16%, which is double of what it was in January. Again, a similar finding because of the difference in vaccination adherence between people who are older and people who are younger. The rate of infection has risen from less than 3 cases per 100,000 people 4 weeks ago to more than 54 cases per 100,000 people this week. That is a dramatic increase. And if you look at the people across the globe, we are talking about more than 611,000 Americans who have died from this plague and millions across the world. The current spike of cases, 99% of the deaths are occurring in unvaccinated people. That is not a made-up number, and it is very striking and says a lot that I will get back to in just a minute. Unfortunately, Alabama remains the least vaccinated state in the nation, and of course, our cases are rising dramatically as well. We know that all of us have suffered mightily from the pandemic since it began in the last 18 months. Some of us have had the infection. Many of us have provided support for people who have fought the infection. But even so, in the Southeast where we live, about 2/3 of the population have so far chosen not to be vaccinated for any number of reasons. Some reasons are totally fictitious, and other reasons do have some merit, and I will certainly speak to that. Things like the vaccines are experimental, I'm young and healthy, I won't get the COVID because I've been around it and I haven't gotten sick yet, so I won't ever get it. The pandemic is over, vaccines will destroy my fertility, the vaccine is a government plot, I have the freedom to choose, nobody can tell me what to do, the doctors are lying to me. These are many of the excuses that people sometimes give for avoiding the vaccine. Well, where does that leave us now? Well, enter Delta. We had told the population that variants or mutations of the virus were likely to occur if the virus was able to continue spreading unchecked. And indeed, just as predicted based on other viruses, indeed new variants have emerged. We used to give these variants a combination of letters and numbers, but that became extremely confusing. And so several months ago, they were renamed to Greek alphabet letters in order to make it more clear. So the original COVID would be what we call Alpha. And so now we are on Delta. And there's been several before Delta that emerged from Brazil and other places. The current Delta actually emerged from the country of India. Unfortunately, it was not stopped in India because they have very low vaccination rates, and millions of people in India died from the Delta variant. We were hoping that the vaccine would be completely protective against Delta, but as I'll show you currently, it is partially effective, but still the best thing we have. Unfortunately, the future does not look very favorable as we continue on the trajectory that we're on, and modeling, which has proven to be extremely accurate throughout the 18 months of this pandemic, will show by Labor Day, cases will skyrocket to 2 and 3 times the peak that we experienced in January of this year. So we are really at the beginning of a major spike that potentially could be much worse and much more widespread than what we even experienced the end of last year and the beginning of this. Interestingly, that almost all of these cases are now considered preventable. That's particularly troublesome to healthcare workers who struggle valiantly. I know doctors and nurses, respiratory therapists, and others who work tirelessly to take care of people whose hospitalization and death could otherwise have been prevented with common sense measures that we have been trying to push out for months, but have been ignored by some people. And unfortunately, we continue to have a small but very vocal group of people who are steadily trying to push out misinformation on social media and elsewhere. I'm sure there will be negative comments even about this video, not because there are facts that will support a contrary view, but because of the mistrust that has grown in the community against any type of factual information from authority. So we are now fighting a two-front war. We're not only fighting COVID, but we're also fighting misinformation, which is extremely discouraging to those of us who try to prevent disease and save lives. So has the vaccine been at all successful? The answer to that is an unquestionable yes. According to new estimates, the number of COVID-19 deaths that have been prevented just by the vaccines that we have received, let alone those that we could have received, are hundreds of thousands of Americans are now alive that would not have been had the vaccine not been available. And it is also estimated that that would have prevented 1.25 million hospitalizations if there had not been vaccine. So basically, there have been 279 additional deaths that would have occurred. That would be 46% more if there had not been vaccine. So we are pleased with the results of the vaccine, even in the low numbers that it has been used. So imagine what would have happened if people had adhered to common sense recommendations. Let's talk about Delta, since that's in the news a lot, and that has spurred a lot of new recommendations, which is one of the reasons I'm bringing you this update. So again, Delta is not last year's COVID. It is sweeping across the United States at astonishing speed. Again, I mentioned it was first identified in India, and it may have caused as many as 3 million deaths in that country alone. In just a few months' time, it has spread across the globe. Why is Delta different than the previous versions of coronavirus 19? Well, it's much more contagious. In fact, it's considered to be about 60% more easily passed from person to person than the Alpha version, which was first identified in the United Kingdom. So in the past, a single person would have statistically spread the virus to 2 or 3 other people. So if I have COVID, typically I'm going to infect 2 or 3 other people with the original COVID. The current Delta, the reproduction number, meaning how many people is infected from one case, is now 6. That's the big difference between the previous COVID and Delta COVID. So that now if I have COVID, I can expect that 6 additional people will now become infected, who will then give it each to 6 more, and you can see how dramatically that number increases, which is basically exactly what we're seeing across the US and in Alabama. Not only is it more contagious, it's associated with worse outcomes and more severe disease. This does make sense that every time a virus mutates or becomes a variant, it has to be stronger than the one before it. If it's weaker, it won't spread, and it'll be protected by people having previous infection or having been vaccinated. So each time the virus mutates, in order to become a variant that we recognize, it by definition has to become more severe. And so that is the case now. We have much more increased risk of hospitalization and death. So the Delta variant has raised the risk even higher. In fact, it's doubling the odds that an infected person would need to be hospitalized or would die from the infection compared to the original COVID. Why is this the case? Because of the mutation on the virus itself, it's considered to be a little bit more springy. And what I mean by that is that it adheres to the cells in your nose and throat better than the original COVID. So it sticks in your body better, and that means it can reproduce itself, make you sick, and then be able to be spread. So in 2020, it took approximately 6 days from the time you got infected with the COVID to where you become symptomatic and be able to spread it. With Delta, that number is down to 4 days, meaning it moves much more quickly in you, and it is able to infect others through you in a much shorter time. The other thing is that there's many more viruses, which is one of the reasons for the increased infection. About 1,000 times more viruses will reproduce in your body and be exhaled into the air than the original COVID, also explaining why it's so much more contagious. So again, it's the perfect storm, but again, this was previously predicted. So what about the vaccines? Are they protected against the COVID variants? In an answer, yes, partially that is the case. Now remember, the current vaccines were formulated against alpha COVID. To say that the vaccines are ineffective because now there's people who have breakthrough cases is inaccurate. The vaccine was formulated for alpha COVID. This is now Delta COVID. The fact that we're getting any protection at all is miraculous, in fact. And studies are showing that people who have had the vaccine are extremely unlikely to be hospitalized and even less likely to die. Unfortunately, however, if you do have the Delta variant and were previously vaccinated, you could become infected. But if so, it's almost always an extremely mild case, either asymptomatic or just a mild head cold. So yes, the vaccine is protective against hospitalization and death, and partially effective against even getting infected yourself. So it's still a good idea to get the vaccine. What are the numbers that I can tell you? So if you have had 2 doses of the vaccine, even against Delta, which is now the predominant strain across Alabama and the United States, over 80% is now Delta, so pretty much we'd say all of them are Delta. That's about 80% protective against getting sick at all. So again, that's a very good number. 94% protective against getting hospitalized. So again, it's still a wise idea to become vaccinated. It's still life-saving for sure. So what about breakthrough cases of COVID that I just kind of alluded to? What does that mean? That means someone who has been fully vaccinated, and again, to remind you, fully vaccinated means it's 2 weeks after your last dose of COVID with the 2-shot COVID vaccine, or 2 weeks after the single-dose COVID vaccine if you choose to get that one. So 2 weeks after, you are considered then fully vaccinated. If, however, you get infected with COVID, that is called a breakthrough case, and the numbers of breakthrough cases are slowly increasing. For example, in March, only 2% of cases were considered breakthrough. That went up to 5% in April, 11% in May, and then 20% in June. So again, the vaccine is effective, but there is a increasing number of breakthrough cases, which is why the recommendation for renewed masks indoors for all persons, whether vaccinated or not, came into play. It was not known previously if a vaccinated person could spread it. Once that was confirmed, the recommendation was to wear masks indoors, in public, if you are in an area of substantial or high transmission. Those three criteria have to be met. So again, indoors if you're vaccinated, in public if you're vaccinated, and in an area of high transmission, such as we are currently in the state of Alabama. And you can get the numbers whether we are in the substantial or high transmission, which is updated daily on multiple websites, which would tell you if that is the situation here. So just to remind ourselves, COVID is continuing to increase primarily because of Delta. Delta is here because it is able to mutate. The virus is able to mutate because it's able to spread, and it's able to spread because we have people who are unvaccinated and people who are not wearing masks and spreading it to others. If that's your situation, please get tested if in fact you have any symptoms of COVID. It's also now recommended that if you have been vaccinated and are known to be exposed to someone in close contact, you should be tested about 3 to 5 days later. You do not have to quarantine as a vaccinated person, but it is recommended to be tested. And if you do test positive, then you will be isolated as a case. So thank you for your attention in listening to the current status of COVID, the current status of the Delta variant, and the situation as we continue to come along with it. I will keep you updated. Thank you for your attention. Have a good day.